We move forward now again to the Charité Mayo conference exclusive first scientific presentation, 20 years in ovarian cancer surgery, and together with real-world evidence in advanced ovarian cancer. And it's a great pleasure for me to introduce Jalid Sehouli. And I think nothing more is, no words are anymore necessary.
So sorry for looking to me, but I was, yes, I mean, yes. So first of all, thank you so much that you go in dialogue. And so we started in 1996 with this wonderful collaboration to celebrate even the science and even the community. And I was thinking that to bring exclusive data to the Charité Mayo conference is really crucial. And I was proud that we have yesterday seen amazing data from the Ruby trial. This was even something outstanding in our history of the Charité Mayo conference, because this was a study of the community. And second is to present even data what never been presented before elsewhere. And that was the reason why Dr. Niemeyer and Dr. Ambrose yesterday presented the Allostent, how to overcome complications, the urethral leakages. This for the very first time in the world, because we want to share experiences. So we always look on clinical trials and we look how we can select the data. And I love to show you today some data they really finished yesterday. Because I was thinking if we worked on the program to present the Charité Mayo conferences, the different topics, then we decided to go 20 years back into 1,900 cases in ovarian cancer. And I was proud that we started in 2000 a prospective tumor bank and a prospective registry of our patients. And I think it's time to debrief and to look in 20 years before I been retired maybe. And so it's good to show. And first of all, if you like to go in 20 years and to look on all the patients, you have to look on the updates and the follow-ups. And then your expectation is much higher than it's in the real world, despite the fact there's so much work already done. So we took many months now to update all the data, and not all of the patients are really from the city, sometimes from abroad, from other continents. And so what's about the follow-up? So at the end, I'll give you only some insights. And, you know, we worked since many years, and I was so thankful for Professor Lichtenegger that he supported me in 2007 to certify the first ovarian cancer center in the world. There was no discussion that it's a ovarian cancer center. In 2007, we decided at Charité to make an official ovarian cancer accreditation program. And everybody was thinking we are happy to go to psychiatry, because it was the area to start with breast cancer units. And even this was debatable at this time. And nevertheless, we did it because we want to harmonize the programs. And I only want to show you that you need time to bring this infrastructure and a level you like to be. And we just mentioned that infrastructure is really the backbone and experiences, and even to be integrated with other centers and with other disciplines. And that's the reason I want to show you that even in the COVID-19 pandemic, we've been able to continue our work. And it was different in Germany, that we have been able to continue even the COVID-19, for instance, our surgical procedures. So Charité had more than 500 intensive unit beds at this time. And you see there is some, that's not triggered by me, this telephone call. Most of them are triggered by me. Yeah, don't be afraid. Nevertheless, the impact of progression-free and overall survival, I want to show you, because the long-term survival data for the recent data are not ready, but there's a clear trend in that patients live longer from year to year. So we are able now to present long-term survival data for 10 and 15 years. And I'm really proud that we can really talk about cure. And we have a big project running on how to characterize these patients more and more in detail. And this is only the insight exclusively. I have much more insights for you about 1,900 patients, but I want to thank my team, and I want to thank my previous teacher, Professor Lichtenegger, that we have been able now to work on this. I want to thank Ionner that we have a prospective registry, and this is part of real-world data. We have to switch very short to the real-world data. It's pity that you have not the right presentation, but it doesn't care. So I want to show only maybe 3 or 4 slides for the real-world data. So this is real-world data because Dr. Krankenberg, please give a move where you are. Stand up. So he's one of the youngest colleagues in my team, and I asked him to track a patient with ovarian cancer, 2.5 weeks in my hospital, and he did a wonderful job. So 144 people, individual from the different profession, touching one woman with ovarian cancer in my center. So now think about the procedure, think about the communication, think about the platforms where you're sitting down, and think about interaction of the different profession individuals. This is an infrastructure, this is a center, and first of all, we have to visualize this multi-professional and interdisciplinary approach, and that's the reason why I love that we see in real world our data, and because it's hypothesis generating, it's confirming the adherence for guidelines, for instance, and we have to use these data to become better in the clinical care. And that's the reason I'm proud that we introduced in Germany the quality insurance program since more than 20 years now. And I want to motivate the community to use this much more than we did in the past. And I think the endpoints we have, it's impossible to go retrospectively because it's highly selected and the bias. But what we talked about, the patient-reported or patient-relevant endpoints should be addressed in these studies. And I think with NGOD, with DOG, and with the study groups, we have the best environment to do this. And that's the reason why I like to highlight this in our program and to motivate the young generation to do this, because quality of life is one of our key points, and I'm so proud that we now introduced prospective trials, a so-called SCOUT trial, and this trial look prospectively in patients with ovarian cancer until 7 years of their disease, 7 years from the diagnosis until long-term survival or the death of the patient. And I'm very proud that we have already enrolled now, I think, 260 patients. And I think this should be translated even to the other groups and regions to use these relevant data, the SCOUT study. So if you are in Germany, you are happy to invited on this. And I want to close this short session with one patient. She is 44 years old. She has a MSH2 germline mutation. And I did surgery on her. I can tell you 14 hours I did it on her. She has Lynch syndrome. And 3 weeks after the surgery, after 13 hours, 3 weeks later, she had the same tumor burden as before. And I started immediately with chemo, with Taxocarbo weekly, 80 milligram Taxo-ACT2, and she progressed under this chemo 2 months ago. And then we started with Pembro off-label. And this patient is now 2.5 years later of targeted therapy.
visualized and personalized, and to look where did the patient enter a social environment. So that's the secret, that's the code.
It's from Monday.
Happy to be in Berlin, and all the best to the International Charity Mayo Conference.
So this is now 3 years after this situation, and that's the reason we need to go beyond. Thank you very much.